All right, we're going to go into a 3-phase approach to rehab now, and this is going to be what rounds us out for the year. So we're actually covering the last bit of curriculum that we haven't covered to this point, and then we're just going to review like crazy because we have just a final test. So I'm not going to do a test on this unit. I'm going to point you to all the Quizlets that I've made throughout the year, and especially the final Quizlet, which is on Canvas. This is a college class. The final is not easy, and you need to understand not just terms but concepts. You need to understand concepts. So if you're kind of going like, I don't know what I remember from sports med, maybe you better study. So, and I would give it at least 15 minutes a day from here to the end, because it's going to be a tough test, and the grade you get in fourth term will match the grade you get on your college transcript. So we will account for terms 1 through 3 by having like percentages from those terms, but majority of it comes from that final test. So remember, tests are 40% of the grade, and this is a biggie. If you don't get this one, your college grade could suffer. So there's really no excuses. You need to study. Okay, so in phase 1, we still have inflammation. They just got injured and there's swelling and loss of function. Just kind of think of inflammation and those 5 symptoms. That's happening. So in this phase, our goal is to decrease the pain, decrease the swelling. We don't want inflammation to go away, because inflammation is the body's reaction to injury, and it's there for a reason, but we want to decrease it a little bit. We're going to try and increase range of motion. So that's what ROM stands for. If you get injured, you'll probably notice, let's say that this is, since I don't know what's happened to him, but since he's got all the bruising on the medial side, maybe he had some kind of an eversion sprain or something like that. When you sprain your ankle, it's not like if this is the bottom of your foot, or let's do it like this. Say this is your foot and this is your leg. We still want plantar flexion. We want some dorsiflexion. So sometimes what's going to happen is like, it hurts to go that far. It hurts to go that far. We need to get that range of motion up. So the other thing that we can do, let's say this looks like her right leg. So we're not going to really go, let's load it. Let's go ahead and load it. Put some weight on the bar, get her squatting. No. What we're going to do, though, is the good leg, we're going to train it kind of the same or as much the same as we can, because you do have nerve signals that are firing, muscles that are contracting, and our body likes to be kind of synchronized. So if we've got those signals going, we have what's called muscle memory, and we can actually kind of bring back full function of this one a little bit later, and better if we've actually been working the unaffected limb. So there is a crossover effect. Once this heals, if she's been working her other leg, she's going to improve faster. Okay, we also want to give some love to the heart and lungs always. So if there is an issue with the leg, they have the upper extremity ergo bike. They have the pool, which negates the effects of gravity. So we still want to do things with this patient so they're not completely sedentary. It was kind of, when you looked at back pain a long time ago, they used to be like, just lay down, don't do anything. And people were actually getting worse with their back pain. And now they're starting to say, like, I don't know that just resting is the answer. We've got to get it back to functioning. So we've got to do stuff in order to get that back moving the way it's supposed to move. So in this phase of rehab, they'll probably need some immobilization. So that's what these are. You can do isometric. Remember, isometric means same length. So our actin and myosin are coming together, but they're not running through the full range of motion. They're kind of contracting, stopping sort of midway, and holding like a plank or a wall sit. Those are isometric exercises. So kind of take into consideration the injury and where else you could train the body. That's kind of what we want to do. So we talked about ideas on what we could do for heart and lungs. And a couple of the modalities in this phase, we're going to use some muscle stimulation, which is the little zappers. And of course, rice. Okay. Phase 2 then. Now here we have pain and swelling controlled. Cast is off. Crutch is gone. We're going to go ahead and move into our goals of maybe we got some range of motion back in phase 1. But now let's say that the range of motion goes from, if we're talking about a wrist, okay, flexion, extension, hyperextension, there's a certain range of motion that we expect. And if you were to injure your wrist, maybe you could only go that far. Now we want to go all the way through that range of motion. We want to push you as hard as we can to get you back there. And when I say as hard as you can, sometimes that is dependent on the patient because maybe they can't tolerate a lot of pain. Sometimes that's dependent on just where their tissue has healed. So we're going to be aggressive without being overly aggressive because we don't want to injure them in the process of healing them. So increase muscle strength. So we're looking at the training unit again. We're kind of going like, how do we increase muscle strength? Well, we're going to lower the weights. Up the weights, lower the reps. You can see in this next bullet point, they're like, you can also work on muscular endurance. In muscular endurance, we're going to up the reps, lower the weights. We can start to work power. So think of power lifts, like a squat or a deadlift, even like a bench press, or think of plyometrics. Like sometimes we're getting back into some pretty explosive movements. And then obviously love and concern for the organs that keep us receiving oxygen in our cells. Heart and lungs need love. So there will be passive, active, and resistive exercises. So kind of think of a physical therapist will use hands-on manipulation a lot. And so sometimes they're actively moving you and sometimes you're actively moving yourself. Sometimes we can take a band and move through a range of motion with some resistance. Obviously we're moving into like all full-on weight training again. So we want to cross train again so that we're giving some love here. And here are some examples of modalities. I don't want you to think that this is all encompassing or frankly, I don't want you to think that I know anything close to what a physical therapist thinks, but I will tell you with modalities, muscle stimulation is used pretty much throughout in most cases. When we get to phase 2, a lot of times they're going to heat you up first. Heat you up. We want blood flow to the area. So that could mean like you stick your twisted ankle in a hot bath, or maybe we do a little ultrasound or something before, move them through the range of motion. And then after, we want to control for pain and swelling again because we've kind of gone, we've stressed the tissue that was injured. So we're going to go ahead and use cryotherapy, so cold after, to control for swelling and inflammation. Well, I guess inflammation. Phase 3, this is where we're going to get back now. So if these or the injured people, we just want to get them back with the team. We want to get them returning to play, essentially. So this is where the tissue repair and remodeling is occurring. We don't want to get adhesions. So, we specifically don't want adhesions to form kind of counter I want to say grain, and that's the wrong word. So if your tissue's running this way, we want the adhesions to kind of run with the tissue. And physical therapists are amazing at piecing that together. So goals here, let's get to functional exercise. So a lot of times if you're in phase 1 and 2, you might have been just going through some regular strength training, regular cardiovascular exercise. We want to get more specific. So if their sport is basketball like this, we don't want to be like, okay, I want you to just keep doing bicep curls and that's going to be your training, because that's not going to do much for their game. So we want to get back to functional exercise. So we're still doing strength training. We'll still do cardio exercise. We're still trying to improve range of motion. But now we're like, get in there with the team, do drills, listen to your body. We want to watch them, and especially if we've never seen them play on the field or the court, we want to see if maybe their injury came from incorrect technique. So we want to address like, okay, how is it that you're doing your layup? And if their body's doing something weird, we want to try and be corrective in the technique and give them some clues that way. Maybe involve coach, maybe athletic trainer, and say, guys, let's target this bad behavior so we can not have them get re-injured. We want to restore balance and proprioception. So that's a lot of times unstable surfaces. We're going to employ those so we're actually getting the muscles stronger, and kind of all the way up. If you use an unstable surface, let's say you get a Bosu ball and you turn it over so the ball slides on the floor and you're standing on the platform, and you do squats on that. When you do that, if you were just to do an air squat without any unstable surface, you're going to recruit a certain number of muscles. When you start to introduce unstable surfaces, well, then you incorporate more muscles. So a lot of times core will have to stabilize. You're really having to do a lot more with the whole with the body than if you were just on a stable surface. So it could be that let's just say, I think it's like 5 times. I think you're 5 times as likely to have a sprained ankle if you've done it one time. So this might be where we go. Do they need a brace? Do they need to wear a brace permanent? Because that could help them. And the idea in phase 3 is let's get that athlete back to functioning, especially if they're good, because we want to win. So in phase 3, basically everything's on the table. Strength training. We're going to do things where we're unilaterally training and then bilaterally training, balance board, jump training, drills that are involved in their sports, and then hopefully we're going to get back to practice, back to games. Some other things that we're using, ultrasound and massage. You likely would still be using some thermotherapy before exercise, some cold after. Good stuff. So really think about seeing a physical therapist if you need to, and going through the full if your doctor recommended 3 sessions or whatever it was, go through the full time with the physical therapist, because they really do move you the way you need to. Okay, I've mentioned overload several times in this unit because we want to progressively get better. So to do that, if we know that a part of the body can do 10 reps at this weight, we don't want to keep them there. That'd be pretty dumb. If their goal is to be a I don't know, power lifter, let's say, I don't know, we're going to want to get them to lift more and more over time. If this is a basketball player and we're like, hey, look, we got range of motion and they can do a plank pretty good, well, that's great. But how do we get them back to what they were doing before? So it could be that we need to work on resistance. It could be that we need to work on repetitions. Maybe so we can look at the FIT principle and say like frequency, intensity, time. We can focus on those. But the idea is if your muscle can do this much, how can we push it so it can do this much? We just want it to get progressively challenged, which means progressively better. And then we use this other principle called SAID, which is specific adaptations to imposed demands. So if you're constantly picking up something like this, sometimes they call us mother's arms because they're picking up a kid all the time. You're picking up the kid, your biceps will grow if you continually do that. That's a specific adaptation for that mom to the imposed demand of picking up their kid. You have the same principle in sports. If you want a kid to get better at a layup, then you're going to do layups. You're going to do a nauseating amount of layups. So kind of think of whatever their conditioning program end game is. It's going to be different for a football player and a soccer player. It's going to be different. So you have to be specific, but you have to overload it, and you have to consider which muscle groups are involved and how that's helping the injury that was initially there. So that's basically it. Said overload. Okay. Rehab. So in kind of the third phase of rehab, and really in training too, like all of this stuff, all of that. That's what those bags are for. We have some fun things. If you ever want to come visit, if you're a senior and you're like, I wasn't there when we got to play with the little hurdles and things like that. So we've got little hurdles and cones, and there's a thing you can hold on to while a person runs to give them some resistance while they're running. And then the parachutes thing I told you about last time. If you ever want to come back and just play with the stuff, because it was for you guys that I got it, come see me, because I'll always have candy. And boy, I feel like I owe the class of 2020 something. I know this is nothing I had control over, but it's rough out there, man. I hope everyone's doing okay. I hope you're finding the content. Please focus on understanding content from here out. We're almost done. We've almost closed the book on sports med. I have had a wonderful time with you. So study, study, study. I'll see you next time.